Hey guys, welcome back. It's Pam, your dental hygienist of 21 years in a general practice office. So we're going to talk about root canals, to do or not to do, and what happens with them. Too bad we're not like sharks where they lose thousands of teeth in their lifetime and regain them. We unfortunately end up with root canals or we have to extract the tooth. So what I'm going to do is talk a little bit about an x-ray. This is someone I know personally. So this tooth is a second molar in his mouth. And this root canal was about 10 years old. But within those 10 years, he constantly complained about pain and discomfort. This root canal was done by a general dentist. When you have a root canal done by a general dentist, the outcome is less desirable, typically because they don't have the skill or the equipment. They do say the success rate of root canals is 86 to 98%. I don't really think that's correct because out of 10 root canals, probably at least 6 are bad or going bad, and then there's the ones that we don't know they're bad because it doesn't show on the x-ray. This in particular, the root was not filled all the way to the apex, which would be the end of the root here. He probably filled 3 of the canals, but there probably are many more accessory canals. There could be up to 6 roots, sometimes 7 in the second molar. Typically it's 3 anatomically, but there's many more. The other problem, this patient, he complained about pain for a decade. When he went to an endodontist to have it retreated to potentially refill and clean out the canals, the endodontist said the tooth looked fine and he didn't understand why the patient was complaining about pain. Then he cut the gum open and a massive amount of pus poured out of the tissue, and the endodontist said it was the worst infection he had ever seen. That infection brewed for over a decade. He had to have the tooth removed. It's gone. We did not replace it with an implant. He doesn't miss it, but he had active chronic infection for a decade that nobody caught. So unfortunately, he lost a tooth recently. We opted never to do a root canal again, knowing the outcome for him. But sometimes root canals can be good because they can preserve the tooth until you can afford to do an implant. So it's something to think about, and you should discuss it with the dental hygienist because she'll probably give you more pros and cons than the dentist will. And I know a lot of people say root canals are super successful, but I see it all day long, and they may fail after 2 years, 5 years, a month. It really depends on the procedure, the person doing the procedure, but most likely you're going to end up with extracting that tooth and needing to do an implant. Thanks for listening. Subscribe if you want to hear more. Bye.